Hello, everybody, and welcome to the Tuesday edition of Video Clips. And just a couple of announcements. First of all, last couple of weeks before tuition prices go up. So if you want to lock in, if you're doing professional development programs with us, like our nutrition educator program, which is the equivalent of, it's very similar to getting a bachelor's degree in nutrition, although it isn't that, but it's very similar in terms of academic rigor and that sort of thing. And our certified health educator program, we have several different programs that might interest you, but prices are going up and you want to lock it in, I think, before the prices go up in June. So send me an email at pamhopper@msn.com so we can set up a time to talk about it. Okay, so that's the first thing. Second thing is I finally have the conference lineup done for November. We have a conference in our office every year, and we have very limited in-person seating. So if you want to come to Columbus and be in the same room with the speakers and have dinner with us and all this, it's time to register because we really only have a few dozen seats left and then that's it. Everybody else will watch remote. So there's a member and non-member price. You can go to WellnessForumHealth.com and you'll see where the conference stuff is. The registration form is posted online and that sort of thing. You can get it into us. And we also have posted recipes. Those of you who are fans of our food can go to WellnessForumHealth.com and see recipes, and we'll keep adding to it over time for all of our dry mixes that are shelf stable and that sort of thing. So we'll keep posting. We're going to get some pictures up pretty soon too. But right now the recipes are there. If you want a complete catalog with ingredients and all that sort of thing, just send me an email at pamhopper@msn.com. All right, so for today's topic, it's another episode in the ongoing series I call Everyone Knows. All right, this is where I feature something that everyone just knows to be true in medicine actually is false. So here's the everyone knows statement. Everyone knows that inflammation is bad. And as soon as an injury occurs or pain develops and inflammation is involved, then you want to take some kind of anti-inflammatory drug. That's the best thing to do. Lowering inflammation, we're told, is a key to recovery. But it's actually not true. So let's start with this. There's a lot of misunderstanding about inflammation and its role in healing and that sort of thing. So inflammation is a natural process and it can be beneficial or even essential for healing. It's an important part of the immune system. It assists in healing injuries, wounds, and damaged tissues, and it defends against viruses and bacteria. If your body could not mount an inflammation response, wounds and sores would not heal and infections could progress and even result in death. So some of the symptoms of acute inflammation and what they actually mean in terms of what's going on are pain. That's in part due to the swelling that's caused by fluid buildup, which places pressure on the nerve endings. Redness due to capillaries, which are filled with more blood. Immobility or loss of function in the inflamed area, and that's sometimes because it's nature telling you you're not supposed to move around in this area right now. Heat due to increased blood flow, and of course you need increased blood flow to bring the troops, as it were, in to clean up the area and take the debris away. All of this is designed to facilitate healing, delivery of immune cells to the site of infection, to destroy pathogens, to stimulate local blood clotting, which creates a physical barrier to the spread of infection through the bloodstream, to promote tissue repair. And then, as I mentioned before, you've got to remove all the debris, the dead cells and the garbage from the area. So if inflammation is a natural response to injury and trauma, and it's needed for healing, what happens if a person takes an anti-inflammatory drug, such as an NSAID, non-steroidal anti-inflammatory drug, as soon as an injury occurs to reduce inflammation, swelling, and pain? Well, a recent research study reveals a clue to the answer to this question and also offers some insight as to another question that people often ask. Why is it that some people who have an injury have long-term chronic pain while others recover and they don't have any residual pain, even sometimes when they have identical injuries? Well, the authors of the study reported, I'll just get to the bottom line on this, that patients who had lower back pain, along with higher inflammation levels at the time that they were seen by a doctor, were more likely to see their pain resolve within 3 months than patients who had lower levels of inflammation. The researchers reported that blocking the inflammatory response with medication seems to prolong musculoskeletal pain. Interestingly enough, the same result was found in mouse studies. Blocking inflammation with the steroid drug dexamethasone or the NSAID diclofenac alleviated pain within the first week, but resulted in more pain in the long run. Mice, on the other hand, that were given a saline control or pain medications that didn't lower inflammation levels had pain resolution in a significantly shorter period of time. So here's the bottom line. People all over the world reach for anti-inflammatory drugs as soon as they feel discomfort or pain, and most people think that all inflammation is bad. Doctors reinforce this idea and prescribe drugs for inflammation and pain. But actually, only chronic inflammation is bad. Acute inflammation is needed for healing. So the next time you have an injury, a fall, a car accident, you bump into something, you wrench your back, best to just let it heal. Pressing through and dealing with the discomfort now is the best chance of not having chronic pain in the future. So once again, everybody knows is wrong. In fact, whenever you hear one of these statements about healthcare and medicine, everybody knows this is the right thing to do. That should be your clue that you really want to check into it, because probably it's the opposite of the right thing to do. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you tomorrow with more news.